I'm going to say something today about lessons learned about trust, engagement and behaviour. Who am I? I'm Susan Michie, Director of the Centre for Behaviour Change, and we bring different disciplines together to address problems of behaviour change and also translate that academic expertise into the outside world through various training, conferences, etc. I've had various scientific advisory roles for the UK government. I also serve on Independent Stage, which I'll say something about, and served as a COVID consultant advisor to WHO, Behavioural Insights team, and also I've been on Lancet's COVID-19 Commission, its public health task force. So human behaviour is at the heart of causing and transmitting pandemic infections, but it's also at the heart of preventing and getting out of them. And whose behaviours are we talking about? Citizens, for sure, but also health professionals, employers, service and environmental planners, business leaders, policymakers at national and local level, even politicians. So what are the key areas for citizens' behaviour? I think we're all familiar with the personal protective behaviours of distancing, being outdoors or ventilating indoors, wearing face coverings, hand and surface hygiene. Then adherence to public health measures and rules, for example, the test, trace and isolate system, or border controls or lockdowns. And thirdly, vaccination uptake, because obviously vaccination is only as good as the arms that it actually gets into. So where does psychology and behavioural science come in? Well, both have generated a large amount of evidence over this last 2 years and advised governments about policies and interventions to enable and support changes in behaviour, such as adherence to rules and adopting protective behaviours. An effective pandemic management strategy requires good leadership that engenders trust, good communication so people know what to do, when and why, effective community engagement, and countering misinformation and disinformation. And each of these have a large empirical and theoretical body of knowledge in psychology. I'm only going to have time to touch on some of these today. So first of all, leadership and trust. Here's an article back in 2021 looking at trust in government. And what they did was look over 23 countries. They had almost 24,000 participants, both cross-sectionally and longitudinal. And what they found was that governments that are perceived as well organised, fair, and disseminating clear messages and knowledge on COVID-19 are associated with being trusted. And higher trust in government about COVID-19 control is associated with higher adoption of health behaviours and also pro-social behaviours. And thirdly, higher trust is associated with lower rate of decline in health behaviours over time. So very important, this whole issue of leadership and trust. Also necessary are good communications, so people know what to do when and why. It's needed for promoting well-being. It reduces confusion and therefore anxiety. Good communication also promotes adaptive behaviours by providing knowledge, as I've said, what to do, when, in what situations and why. And persuasion, building trust and therefore adherence to advice. I'm just going to share with you now half a dozen key evidence-based principles of communication that were identified in the UK government's behavioural science part of its advisory group. So first of all, developing consent and trust, showing respect and drawing on voices that are trusted by the group that's being communicated with. Secondly, demonstrating empathy around the difficulties people might face and showing gratitude for the effort that's made by everyone and emphasising the positives, what people are doing, not focusing on what people aren't doing. Be transparent about why the government is taking certain measures and the science behind the policy making. Use simple, clear, precise, coherent and consistent messaging. So there should be behaviourally specific to increase the knowledge of what exactly to do. Vague kind of exhortations are not helpful. Fifthly, Don't assume that barriers are purely motivational. Show an appreciation of structural barriers to behaviour, and I'll come back to this. And finally, continually measure the impact of all communications so you can tailor them and amend them in real time to ensure that you're being responsive to what's happening. In terms of promoting adaptive behaviours, how should we go about that? It's not just about communications. We need a model of behaviour, and I'm going to share with you the simplest but comprehensive model of behaviour, and it's called COMBI, based on the fact that behaviour occurs as an interaction between three necessary conditions, one starting with C, one with O, and one with M, and obviously B for behaviour. Maybe you've already guessed what these are. First is capability, knowledge and skills, and physical capability. You need these for behaviour, but they're not sufficient. You also need the opportunity, the physical and social opportunity to enact those behaviours. But you could have the capability and opportunity, and you also need the motivation. You need all three of these in place. And as you can see, these have interacting loops between them. So by changing one of them, you can potentially have a positive effect on the other. So you can further break these down: the psychological or physical ability, motivation, the kind of reflective, top-down, conscious choice, rational decision-making, but also the more automatic mechanisms that activate or inhibit our behaviour. Our emotions, our drives, our habits, these are really important. And as I said, opportunities, both physical, but also the social environment is incredibly important for enabling behaviour. And this is the original article up here in Implementation Science, and also another open access source for a summary of it. So communication only goes so far. It can address capability, increasing knowledge and motivation by persuading, but it's not enough. You need to work in conjunction with changing opportunities for behaviour, both physical and social. Now I want to illustrate this issue with the test, trace and isolate system that all of you will be familiar with, cornerstone of pandemic management. And here we have the Director General of the World Health Organization stressing the importance for countries to test, isolate and trace new cases to suppress the spread of the virus. Now, in the UK, myself and colleagues had a weekly survey of a couple of thousand people every week across the country that we actually had funded in advance of a pandemic breaking out. So it started right from March 2020. And what we found out was less than 50% of those, even those who are symptomatic, were isolating, and less than 30% of those symptomatic were requesting a test. Now, this isn't sufficient for a good test, trace and isolate system by a long measure. Now, is this due to a motivational problem, a capability problem, and or an opportunity problem? Here we had early on a very good paper by Helen Ward and colleagues in 2020, and they found that 87% of the population were willing to self-isolate, and this was across all income levels. But those with the lowest household income were 3 times less likely to be able to self-isolate and 6 times less likely to be able to work from home. And if you go back to the COMBI model, this is showing that there's a strong opportunity element here. The Corsair study that I mentioned before, the weekly survey, again, we found the problem was mainly lack of opportunity. The predictors of low self-isolation was having a low-income job or having financial hardship. The reasons given were caring responsibilities outside of the home, needing to go out to get provisions, or insecure work, low income, insecure employment. All of these things are not to do with capability, and they're not to do with motivation. They're people's real life situations. And so the scientific advice of the UK government as a result of our committee's work based on the research I showed you was that the government should do more to give financial support, ensuring that those required to self-isolate would not experience financial hardship in doing so, and tangible non-financial support. So proactive outreach is needed to identify and resolve any practical needs that people have, for example, access to food or care for elderly relatives. And this is an important part about psychology. Psychology is not just what happens between your ears. It's about how you interact with your social and physical environment in addition. However, in the UK, the government responded as if the problem was one of motivation. If people are on low income, they did end up giving a grant, but it was very small, less than our minimum wage. Only an eighth of people were eligible, and of those applying, only 30% received it. And also they were given a large fine if they're found not to self-isolate. Now, the behavioural scientists did not advise this because we were worried that blame and punishment is counterproductive, and what's needed is support and enablement. We were worried about unintended consequences, that fewer people would get tested or give contacts or download the app, especially disadvantaged groups, if they felt that would put themselves in a position of testing positive and not being able to isolate, or their friends and family not being able to isolate. And what we found, less than 30% of those with symptoms got tested, and in a valuation of mass free testing in Liverpool, only 8% in disadvantaged communities were coming forward to get tested. So this framework, COMBI, is actually part of a bigger framework called the Behaviour Change Wheel, which is the framework for designing interventions. And depending on, one could call it a behavioural diagnosis, the extent to which the problem you're trying to solve requires a change in capability or motivation or opportunity, all the key influences on behaviour. That then points you in the direction of what kind of intervention and what kind of policy might be needed. So here we have the COMBI in the middle. This green hub is our capability, opportunity and motivation. And this was based on a systematic review that identified 19 frameworks of behaviour and behaviour change with a lot of overlap. So this is a synthesis. And if you look from the top of the red ring and read round, we have education, persuasion, incentivisation, coercion, training, enablement, modelling, environmental restructuring and restrictions. And then these can be underpinned by policies, again from the top going around to the right, guidelines, environmental and social planning, communication marketing, legislation, service provision, regulation and fiscal measures. I haven't got time to go into this, but there are resources for you to have a look at how one can apply this. On the right hand side is a user-friendly guide, which is a short version of the book that was commissioned by our Public Health England. And if you go on the Centre for Behaviour Change website, just Google Centre for Behaviour Change, you will find the free PDF. And on the left hand, we have the publication, which in the appendices will show all the different frameworks we identified and how we came up with the framework. And this has been taken up very widely, both across the UK government and other organisations, but also internationally. Now, I want to just end on a model in the UK that I think is really interesting, which is having a mechanism for direct and open communication to the public and press. So the past government scientific advisor, Sir David King, set up a group of about 16 scientists to give independent advice to the public and press. Called it Independent SAGE. Now SAGE stands for Scientific Advisory Group in Emergencies, and this is what the government group was called. At the beginning in March 2020, when this was set up, it was secret about who was on that committee. The reports weren't and minutes weren't being published. I was one of the few scientists who spoke out to the media and said I was on part of SAGE. And he felt very strongly that the public needed to have an opportunity to hear about the science directly. And now, as of May 2022, our government has seized nearly all COVID-19 data collection and communication. So this remains a very trusted and valued source of information. Its aim is to put scientific evidence and debate into the public domain on the basis that openness and transparency leads to better understanding and better decision making. And also it's the responsibility of scientists and those with specialist knowledge to engage with the public and policymakers in order to ensure that science benefits all of society. Every Friday and we keep saying we're going to stop, but we have about 20,000 people often looking at our weekly broadcasts. And, you know, when there's such a dearth of other information, we feel we need to keep going. So it has its own YouTube channel, and we give a database update. We have invited guests, and we do questions and answers with the public, politicians, and the press. And we have a Twitter account, so do follow us if you are interested. Thank you very much for listening. Here are my contact details.